Hi, my name is Patrick Coben. I'm the founder of Great Lakes Seminars. Today I thought I would talk about our advanced manual therapy techniques for the extremities. This class is interesting because I had a number of our higher level people that have gone through our classes, just they've taken 5, 6, 7, 10 classes, and they're like, hey, what else do you have? Because I commonly tell people that in my, the classes that I create, I teach people about 70% of what I do. And it's because, man, a lot of what I do is like, oh, this unique technique for this person, this unique technique for this person, along with all the basic techniques that we use most of the time. So with this class, what I decided to do was teach you a lot of these unique techniques. So it's great because if you've gone to our basic extremity class, which is a great class, one of my favorites. If you're on to our myofascial classes, if you've done all that stuff, you learn a lot of really great techniques. This class is one where, wow, okay, so if I'm treating an elbow patient, instead of just doing a posterior glide or an anterior glide of the humeral ulnar joint, what are the tweaks that I do when those techniques don't work? What are the other things that I do that really fix the person when the basic ones don't? So a medial glide or a lateral glide of the ulna on the humerus, or a varus or a valgus glide of the ulna on the humerus for my throwers, for my tennis elbow patients, for whatever that is. We'll go to the foot, the knee, the hip. And now I'm going to show you, hey, we're going to show you some techniques that use a belt. We're going to show you some techniques that incorporate mobilization with movement. We're really going to show you how you can make sure for any of your patients that are the tougher patients, right? That the normal foundational techniques aren't working with. Hey, now I'm going to give you a bunch of new tools to be able to treat your extremity patients in ways that if you weren't able to get improvement before, now you get them better. And just how cool is that? These are, again, techniques that aren't like once a year techniques that I use, but are just not the foundational techniques that we teach. These are all the other cool techniques, both joint mobilization and myofascial release techniques. Because I'll show you some stuff where you'll be amazed at how certain tissues that we kind of palpate on each other and on our partners are so tender you had no idea, or so tight that you had no idea that were also causing problems that you didn't know about. So what's fun is that this is a class where you'll learn some stuff that you've never seen before in any other class. Not only our class, but probably any other class out there. And it really gives your tool bag new tools that you can use to help your patients more and better. And that's what it's all about, right? How do we help more of our patients better? So this is the advanced treatment techniques for the extremities. It's a great class. Again, when the techniques that I use for most people don't work, these are what I pull out. They work great. Take care. Have a great day.